In this video, I'm going to share with you my impressions of the pill Mavenclad to treat relapsing MS. Don't turn away, because that starts right now. Hey! Howdy! Thanks for learning about MS with me, Boster. I'm the founder of the Boster Center for Multiple Sclerosis, where we care for people impacted by MS from around the globe, both in office and on telemedicine. We accept all major insurance carriers and are currently actively enrolling for clinical trials. If you're interested and want to hear more, call the number below. Today's video is a long time coming. I am asked very frequently my opinions about Mavenclad, or Cladribine, a pill to treat relapsing MS. And in this video, I'm going to finally answer that question. So let's jump in. Mavenclad is a pill that's taken in a weird way. You take a pill once a day for 5 days in a row, and then you're done for the rest of the month. So it's kind of like a reverse birth control pill. On month 2, you repeat that process. You take a pill once a day for 5 days. Then you're actually done taking Mavenclad for the rest of that year. A year later, you repeat the process once more. You take a pill once a day for 5 days, wait a month. Then you take a pill once a day for 5 days. Then you're done being treated with Mavenclad unless in the future you have new disease activity, a new attack, or new spots on an MRI. That's really strange. It's not a continuous medicine because of the way that it works. Many medicines in MS work by blocking transmission of cells. So if you have naughty cells here and the brain's here and there's a barrier, you try to prevent the cells from gaining access. Mavenclad doesn't work like that. What it's doing mechanistically is rather different. I consider its mechanism of action to be that of microinduction. It's really kind of reprogramming the immune response. Mavenclad has its effect on the adult B and the adult T cells, two major cells involved in the immune response and certainly involved in MS pathology. It seems to target B cells more than T cells. And so when you take those first 2 months, what happens is your white blood cell count drops. But this is interesting because it doesn't drop a lot. There are medicines that I use in MS that really drop your white count. This kind of drops it like medium. And if you look at the specifics, it drops the B cells more than the T cells. Now, this happens about month 2, and it only lasts for a couple months. So a few months later, you've dipped down and then you come back up. And then on the second year, same thing happens. And so in doing so, you've suppressed the immune response, but you haven't suppressed it a lot and you haven't done it for very long. And that's really interesting. So how well does it work? That's actually a really interesting question. The clinical trial that was used in MS to study Mavenclad is called Clarity. And Clarity came out actually quite some time ago, like before 2008. And back then, when we did clinical trials, we were still comparing drugs to placebo. Nowadays, we don't do that. Nowadays, there's so many effective MS medicines that when we compare a new molecule or a new drug, we're comparing it against a known drug. But back then, we didn't do that. So the Clarity trial was comparing Cladribine, Mavenclad, against placebo. And so that's the data that we have. So let's take a quick look at it. Compared to taking placebo or a water pill, Mavenclad decreased the risk of an MS attack by 58%. So that's a really good number. Compared to taking nothing, you're decreasing it by 58%. Now, if you ask me, what about compared to something else? I don't have easy data to share with you because that's not how this was studied. If you ask about disability progression, and the definition used in this particular trial was 3-month disability progression, meaning I saw you and you had a new problem on your exam, so something went wrong, and then 3 months later you still have that problem. So you've accumulated some disability and stuck around for 3 months. And when you look at that definition, the patients in the Clarity trial that were taking Mavenclad were 33% less likely to develop that disability progression compared to taking placebo. When you turn to the MRI, again, we're comparing against folks taking nothing, but it worked much better than nothing. And so compared to placebo, Mavenclad was able to shut down contrast and shut down new T2 lesions really well. Another unusual thing about Mavenclad is we finished these trials before 2008. And the first time that the drug went to the FDA said no. They were concerned about safety. And it wasn't until 2018 when they went back to the FDA and reapplied that it was approved. And there was this 10-year period where the majority of the clinical trial patients in Clarity were lost. Actually, like 2/3 were lost. So when you ask questions about long-term follow-up, it's very hard to answer the question because we don't have a continuous group of patients from that trial that we can follow and learn from. So what do we do? It's actually very frustrating, and it would be awesome to be able to turn to rock-solid data. So instead, I turn to rock-solid friends. There are a couple colleagues at Bart's MS in London, England, and they have a tremendous experience with Mavenclad. They've been using Cladribine, both IV and Mavenclad orally, for a long time. And it was a great pleasure to talk to some of them and to learn from their experience. Now, their experience, generally speaking, was very, very positive. That's very reassuring to me. One of the things that was a sticking point for me initially was the way the American label was written. It states that after you take the first 2 years, the way that I described a bit ago, you're not supposed to take any more Mavenclad in year 3 and 4, even if you have breakthrough, which bothers me. It states in the American label, the reason is because if you take multiple courses of Mavenclad, you can increase the risk of cancer. So then I asked the question, well, if I add another drug, am I stacking the risk for cancer? And we couldn't find the answer in the data. Again, I turned to my friends overseas, and they reassured me that that has not been their experience. They certainly feel comfortable using other medicines after Mavenclad. And I'll be honest with you, that turned the tides for me and made me feel more comfortable. Because when I put a patient on a drug, I need to know the out clause, the exit strategy, or what we might do next if things don't work out. And so it took me a while before I came to terms with that. And I'm feeling better now. So what are the risks of taking Mavenclad? What are the safety concerns? Excellent question. When you take Mavenclad, you're suppressing your immune response. Now, you're not suppressing it very much, and you're not suppressing it for very long, but you are suppressing it. And so whenever you do that, there are certain risks that come with it. First off, when you manipulate cells this way, there is a small risk of cancer. And when you look at the clinical trials data, there was no clear-cut specific risk like breast or lung or anything like that. The way the American label is written makes sense. It suggests that before you start Mavenclad, you make sure that the person has their appropriate age-related cancer screening. So if you're of the age of the mammogram, get the mammogram. If you're of the age to have a colonoscopy, get the colonoscopy. If you haven't had your skin checked this year, get your skin checked. And that makes a lot of sense. And you want to continue to have those screenings, age-appropriate screenings, as you move forward in time. Now let's be honest, we should all be doing that. When you drop the white count down, you have a risk of infection. And it's not a very big risk. In the Clarity trial, 49% of the patients that were receiving Mavenclad had an infection, but 44% of the placebo arm did. And that's only a 5% difference. It is important, however, to make sure that there aren't any serious infections before you start Mavenclad. So we're going to screen everyone for HIV and for tuberculosis and for hepatitis, because obviously, if you had one of those infections which suppresses your immune response, you don't want to take an immunosuppressant and push it down further. That would be not smart. And so you do those screenings up front. And then as you move forward, we can check a simple lab test and look at where your white count is. We can see it come down and we can see it go back up. And that gives a sense of confidence because I can monitor and make sure that my patient's staying safe. I know when I need to give them precautions to be extra careful and when their immune system is reconstituted and it's all good. Because Mavenclad messes with RNA, it can create a risk of birth defects if you were to become pregnant while taking it. And so there's very clear and easy instructions. We don't want you to conceive a child for 6 months after your last pill. So after you take your last pill, if you wait 6 months, that's adequate before it's safe to conceive a child. And so family planning, like with any MS medicine, is something that you have to prepare ahead of time. And with Mavenclad, the recommendations are pretty straightforward. So where do I weigh in as far as my opinions about Mavenclad? How effective do I think it is? Well, my opinion is as follows. I think Mavenclad is the king of the pills. Mavenclad, in my opinion, is way more effective than the shots, the interferon beta shots, Copaxone, etc. And when you look at all the oral medications currently available to treat MS, when I compare my thoughts on Mavenclad to all those drugs, I think Mavenclad wins. And so I call it the king of the pills. It's not my opinion that Mavenclad is as effective as the monoclonal antibodies or the infused drugs. So I don't think that it's on par with Tysabri or Ocrevus. I don't think it's on par with Lemtrada. And so I place it as a medium-high range drug, above the other pills but below the infusions. Now, obviously, that's just my opinion, and it doesn't make me right, it just makes me opinionated. And we don't only pick a drug based on efficacy. I just wanted to put my penny on the table of where I think it fits in as far as efficacy is concerned. What about using Mavenclad during a global viral pandemic like right now, and how does it fit in? What's actually interesting, Mavenclad suppresses the immune response. So at first blush, you might say, whoa, be careful, because we don't want to suppress your immune system if you may be exposed to the virus. But I think we have to think a little bit further. For starters, having MS does not increase the risk of contracting COVID-19. Taking Mavenclad does not increase the risk of contracting COVID-19. The risk of contracting the virus is because you come in contact with someone that has it and they sneeze or they cough on you. And you have a lot of control over that by wearing a mask, by washing your hands, by distancing yourself socially. The question is more about if you contract COVID and you were on Mavenclad, would you have a harder time fighting the infection? And I think the answer has to do with timing. There is a window, it's a small window, from like month 2 to maybe month 4 to 6 when we've dropped your immune system. Not a bunch, just a medium range. And during that time, it's conceivable that you might have a harder time clearing an infection. But it's short-lived. And so, all things considered, I think Mavenclad has a place during this global viral pandemic because the immunosuppression is not profound and it's not very long in duration. And again, that's just my opinion. But we have found a good use for Mavenclad in certain relapsing patients with MS in this COVID-19 era. If you'd like to learn more about MS medications, click the playlist that's on your screen right now. My name's Aaron Boster, and thank you for learning about MS with me. Until my next video or my next live stream, or the next time I see you at the Boster Center for MS, be safe and take care.